Another common question that we get from healthcare providers is what do we need to know about gender interactions between men and women according to the Islamic tradition? It's actually not too difficult. Number one, know that there is a heavy emphasis not just on modest dress for both men and women, but also modesty in the way that men and women interact with one another. For that reason, men may request same gender practitioners, therefore male doctors and or nurses if possible, and women the same. That being said, and particularly in the case of Muslim women, whether or not they choose to wear the hijab or head covering, modesty is a principle that they hold to very dearly. Therefore, don't be surprised if they ask you to hang a sign on the room of a private hospital door that asks a doctor or a nurse to knock before entering so that they can ensure that they are dressed appropriately. As we've already emphasized several times in this series, there is a lot of variance on Islamic religious observance depending on cultural background and personal preference. Therefore, I highly encourage you, in addition to knowing the basic foundations of gender interactions and modesty in the Islamic faith, to have an honest conversation with your patient about what they would prefer in a healthcare setting.